My name is Dr. Mayor Tishaura O, and I'm the Director of Health for the City of St. Louis. Welcome to the City of St. Louis Department of Health's virtual COVID-19 pediatric vaccine town hall gathering for parents and caregivers. Equitable access is a pillar of the City of St. Louis's Department of Health's community-based pediatric vaccination plan, and really the main goal for this evening. We want to ensure equitable access to COVID-19 vaccines, but also equitable access to information about the vaccine, which is really why we're here today. We know that there are parents and caregivers in the community who have unanswered questions. We want to make sure everyone in the city has a chance to get their questions answered. As the announcement of the approval of the vaccine approach, I had questions. Before I am a director, I'm a wife to Dr. Jessie Davis, and I'm a mom to two beautiful little girls. My daughter turns 5 on Monday, and she's having her unicorn birthday party this Saturday at Playhouse Museum. And the best gift that I have been able to give her, the thing that has been at the forefront of my mind as a mother, has been the fact that I haven't had every tool available to me to be able to protect her. And so this pediatric rollout is not only something that I'm distinctly proud of from a professional standpoint, but as a mother who understands how long and how anxiety provoking this wait has been, I know that this has been the same for so many parents who've joined us today. Let me take a minute and outline the rest of the evening for you. We are honored to have our very own, the Honorable Mayor Tishaura O with us this evening, and she'll be sharing some brief comments next. Following our mayor and her remarks, our health commissioner, Dr. Frederick Eccles, will share some information about the status of COVID-19 in our community. After Dr. Eccles' remarks, we have allotted an hour to hear from you. During that hour, Dr. Eccles and I will answer questions that have been presented about the vaccine, our pediatric vaccination plans, and all of our efforts. So, our next speaker is someone you all know. She's with us this evening to share some opening remarks. She is passionate about protecting people from SARS-CoV-2, the virus that causes COVID-19, and has made sure her entire family is vaccinated, including her 14-year-old son. So please join me in welcoming the Honorable Mayor Tishaura O to the microphone.
Thank you, Dr. Tishaura O. Good evening, everyone, and thank you for tuning in to this very important town hall. Months ago, I said that we could see the end of the COVID-19 crisis on the horizon, but only if we mask up to stop the spread and get vaccinated to protect our families and communities from this serious illness. The pediatric vaccine is how we can successfully get through this pandemic as a community. Everyone 5 years old and older is now eligible to get vaccinated. I want to emphasize time and time again, vaccines are safe, vaccines are effective, and vaccines are completely free of charge. They are the key to protecting our schools, our families, and our communities. As Dr. Tishaura O said, I made sure that my 14-year-old son, Aiden, got vaccinated so that he can keep enjoying in-person learning with his friends and teachers. I feel better knowing that he is protected from COVID-19 at school. You know, he plays basketball, and getting vaccinated helps make sure that he can stay on the court and continue to do the things he loves. We want our kids to continue to learn safely, in person, and for our schools to remain open, healthy, and safe. As our families gather this week to celebrate Thanksgiving, many for the first time since the COVID-19 pandemic began, we want to make sure that we keep our cases and our new infections down. As we head into the holiday season to celebrate with our friends and family, we need to remember that the threat of the virus is still very real. Vaccination is the best protection against serious illness, hospitalization, and death from COVID-19. So if you haven't received a COVID-19 vaccine, make sure you do so to protect your loved ones. If you're a parent or a guardian looking to get your child vaccinated, this town hall is just for you. Dr. Mati/Yo Davis, Director of the Department of Health, is an expert on infectious disease. She has a wealth of knowledge that she'll share with you this evening. And most importantly, she is the mother of 2 adorable little girls. Dr. Eccles is also a seasoned health professional, and I'm confident that together they can clarify any questions you have. I've spoken often about losing my only remaining uncle to COVID-19 in a nursing home. No family should go through that kind of heartbreak, and getting vaccinated is the best way to avoid serious illness, stay out of the hospital, and keep our families and communities safe. That's why I got vaccinated right away when I could. As a mother, a niece, a cousin, and an elected leader, I strongly urge every family to get their eligible children vaccinated against COVID-19. And also, as the doctor said in her remarks, my entire family, from my dad to my sisters to my son, is vaccinated. Vaccinate your kids to keep learning in person instead of virtually, so they can go play sports or go to school events or do the activities that they love. Do it to protect our grandmas and grandpas, our aunties and uncles, our abuelas, our tios and tias, and all of our loved ones this holiday season. Together, we can make sure that the rest of our school year is the very best it can be, and that our holiday season is safe and healthy. Thank you for joining us tonight, and God bless you all in this holiday season.
Thank you so much to our Honorable Mayor Jones for those remarks. Now, I'd like to ask our Health Commissioner, Dr. Frederick Eccles, to provide us with just a brief update on the status of COVID-19 in the city of St. Louis. And here he's going to especially look at it as it relates to children in this age group, right? That 5 to 11-year-old age group. He has been following COVID-19 data for our city since the beginning of this pandemic. So I cannot think of anyone better to help us go through this data than Dr. Eccles. Dr. Eccles, the microphone is all yours.
Dr. Tishaura, thank you for that warm introduction and for this opportunity. I'm gonna have a brief slide deck that I'll go through. So at this point, I'm going to share my screen. All right, so as you mentioned, I'll be giving a COVID-19 pediatric update, particularly for the city of St. Louis. I'm gonna have no conflicts of interest to disclose. For the city of St. Louis, we really abide by our mission and vision, which really drive the cadence for the heartbeat of what the health department does on a daily basis. Before I go into the actual data, I want to take time to just honor those who we've lost due to COVID-19 with a moment of silence. We'll look at the national data first. And so we'll look at the pediatric population. So overall, there have been several million cases of COVID-19 amongst our pediatric population, those aged 0 to 17. Of this population, those individuals aged 5 to 11 account for 37% of all COVID-19 cases for individuals younger than the age of 18. COVID-19 death data for children as well is really important. And so what we've seen as of November 21st, 939 deaths from COVID-19 have been reported in the city of, in the United States, amongst individuals 18 years of age and less, with 194 of those deaths being in the 5 to 11 age group. This group accounts for roughly 21% of all COVID-19 related deaths in the United States for those who are younger than the age of 18. Specifically in the city of St. Louis, over the last 6 or 7 months, we've seen an increase in the percentage of cases that are being accounted for those individuals 18 years and younger. We've also, within that, we've seen an increase in the number of cases that are attributed to those who are within the age group 5 to 11 as well. For our school age youth, what we've seen, again, we're looking at the data for those who are age 5 to 11, and this would say 5 to 10. We've since the beginning of the pandemic, we've had 955 COVID-19 cases reported amongst that age group, which accounts for similar to what we've seen at the national level. So that age group accounts for roughly 37% of all of the COVID-19 cases that have been reported in the city of St. Louis. And overall, for among school-age youth, transmission among school-age youth saw an initial increase after school began, but has since slowed down. And all zip codes across the city saw 10 or fewer school-age cases over the last month. So up until October 29th, we did not have a resource for individuals aged 5 to 11 for them to give them additional protection against COVID-19. However, on October 29th, the FDA, along with the Advisory Committee on Immunization Practices and the Centers for Disease Control and Prevention, met to discuss the data related to clinical trials that had been held to look at the safety and efficacy of the Pfizer-BioNTech COVID-19 vaccine amongst that age group. And so on October 29th, the FDA Advisory Committee on Immunization Practices and the CDC met, and they eventually approved for the use of the Pfizer-BioNTech COVID-19 vaccine for emergency use in children aged 5 to 11 years. Many of you know the Pfizer-BioNTech COVID-19 vaccine is an mRNA vaccine which contains protein that code for the SARS-CoV-2 spike protein. The ingredients for this vaccine include mRNA, lipids, trimethamine hydrochloride, sucrose, and sodium chloride. One thing that we're really proud of is that this vaccine does not contain preservative. And similar to the two-dose schedule for adults, the schedule for individuals aged 5 to 11 is a two-dose primary series, and each dose is 0.2 milliliters, each containing 10 micrograms of the mRNA. And the doses, again, similar to the schedule for adults, is given 21 days apart. The only contraindications for this vaccine is that the vaccine should not be administered to anyone with known history of severe allergic reaction to any component of the Pfizer-BioNTech COVID-19 vaccine. So it's really important for family members to be aware of any allergies that children may have when they're seeking to obtain this Pfizer COVID-19 vaccine. For the clinical trial, so oftentimes we don't provide this information, but today we're going to be going over this a little bit. So the demographic characteristics of the study participants, roughly there were 51.8% of the participants were male and 48.2% were female. The majority of participants were white or Caucasian, roughly 78% in the Pfizer-BioNTech group were white or Caucasian. And then in the placebo group, 77.5% were Caucasian. And so, but we did have representation amongst other groups such as Blacks and African Americans, American Indians and Alaska Natives, Asians, Native Hawaiian, and Asian other Pacific Islanders. In addition to that, there were also Hispanic and Latinx individuals that were included in the study. The safety summary and data, we're just going to go over some of the safety data that was reviewed and presented to the FDA at the time of the vaccine's consideration. According to the clinical trial data, roughly over 4,600 participants, 3,100 who participated received the vaccine, a little over 1,500 received the placebo, all aged 5 to 11 years. Enrolled in the ongoing study. In this trial, a total of 1,444 vaccine recipients were followed for safety for at least 2 months after they received the second dose. To date, no serious side effects have been detected in the ongoing study. Overall, more children reported side effects after the second dose than the first dose. Commonly reported side effects, which we'll review shortly, in the clinical trial included injection site pain or sore arm, redness and swelling, fatigue, headache, muscle and or joint pain, chills, fever, swollen lymph nodes, nausea, and decreased appetite. More children, as I mentioned before, reported side effects after the second dose than the first dose, and the side effects were generally mild to moderate in severity and occur within 2 days after vaccination, and most went away within 1 to 2 days. This is just the data that was presented to the FDA. Again, fever, fatigue, headache were some of the symptoms or side effects that were reported. Redness, swelling at the injection site were also reported. And the most commonly reported side effect was pain at the injection site. Roughly 74% of participants reported pain at the injection site after the first dose, and roughly 71% of participants reported pain at the injection site after they received their second dose. But overall, as I mentioned before, more individuals typically reported side effects after receiving their second dose. Again, chills, vomiting, diarrhea, new or worsened muscle pain, new or worsened joint pain, use of antipyretic and pain medication were also looked at. And so again, similar to other trends, most individuals reported more individuals reported symptoms after receiving their second dose compared to the first. But again, no severe adverse reactions have been reported to date in this ongoing study. They also presented information on the effectiveness of the COVID-19 vaccine. So the FDA staff reviewed cases of COVID-19 occurring 7 days after the second dose. According to the data among participants without evidence of prior SARS-CoV-2 infection, 3 cases of COVID-19 occurred amongst 1,305 vaccine participants, and 16 cases of COVID-19 occurred amongst 663 placebo recipients. The vaccine was noted to have an effectiveness of 90.7% in preventing COVID-19 amongst 5 to 11-year-olds. Then there was ongoing, again, as I mentioned before, this ongoing randomized placebo-controlled study with over 4,600 participants aged 5 to 11 years. Overall, the children in the vaccine group received 2 doses of the Pfizer-BioNTech COVID-19 vaccine containing 10 micrograms of messenger mRNA per dose. The FDA analyzed the data and compared the immune response of 264 participants from the study to 253 participants 16 through 25 years of age who had 2 higher doses of the vaccine in a previous study, which determined the vaccine to be effective in preventing COVID-19. The immune responses of the younger age participants were comparable to that of the older participants. Again, this is the descriptive vaccine efficacy results in children 5 through 11 years of age without evidence of prior SARS-CoV-2 infection, which are presented in this table. None of the cases accrued met criteria for SARS-CoV-2 or multi-system inflammatory syndrome in children. No cases of COVID-19 were observed in either the vaccine group or the placebo group in participants with evidence of prior SARS-CoV-2 infection. SARS-CoV-2 50% neutralizing antibody titers, or what we call NT50, 1 month after the primary series were compared between randomly selected subsets of phase 2-3 participants 5 through 11 years of age from study, one of the studies which was C4591007, and the efficacy study C4591001, phase 2-3 participants who were aged 16 to 25 years using microneutralization assay against the reference strain. The primary immunobridging analysis compared the geometric mean titers and the seroresponse rates in the evaluable immunogenicity population of participants without evidence of prior SARS-CoV-2 infection up to 1 month after dose 2 in each group. And the pre-specified immunobridging criteria were met for both the GMR and the seroresponse difference. And this is just the results of the first group that was randomized, and then this is the second group subset of individuals that were studied. But again, in both cases, the seroresponse for the younger group, those aged 5 to 11, was comparable to those who were older in the 16 to 25 year age group who received the larger dose. Vaccine administration to date in the city of St. Louis. So this is what's happening locally as it relates to vaccine uptake. For those individuals aged 5 and older, we have 62.3% of the population in the city of St. Louis who have received at least 1 dose of the Pfizer vaccine or 1 dose of the Moderna vaccine and a 1 dose of the Johnson & Johnson vaccine. For those who have completed vaccination, for those 5 and older, we have a rate of 53.9% uptake amongst that group. And then we'll look specifically at those which are age 12 and older, which was the group that was eligible prior to October 29th. 58.4% of that population has completed the vaccination process. Younger children 5 to 11, again, they recently became eligible to receive COVID-19 vaccine. Right now in the city of St. Louis, that population, we have 13.6% of that population who have initiated the vaccination process. For those aged 12 to 17, 59.1% has initiated the vaccination process. 18 to 24, 54.1%. And then for those 25 to 44, 63.2%. And then, as you know, the vaccine has been around longer for the older population, so we expected those numbers to be a little higher. But we are seeing good uptake for the younger population in the city of St. Louis. Reporting of adverse events is really important, as well as parents and guardians as you look to obtain the COVID-19 vaccine for your children. It's important to know that reporting mandates are in place to ensure any issues or complications related to the COVID-19 vaccines are reported to the federal government in a timely manner. And this is necessary to ensure any corrective action can be taken in a timely manner to protect the public's health. In addition to vaccine-related issues, providers are also required to report cases of multi-system inflammatory syndrome in adults and children, and cases of COVID-19 that result in hospitalization and death. Previously, also noted the FDA and the CDC safety surveillance systems have identified increased risk for myocarditis as well as pericarditis following vaccination with Pfizer-BioNTech COVID-19 vaccine, particularly following the second dose, and with observed risk highest in males aged 12 through 17 years of age. As a result, the FDA conducted its own risk-benefit assessment and determined the benefits of the vaccine outweigh its risk in children 5 through 11 years of age. It's also important to talk about some of the advantages of being fully vaccinated as well. So a couple of things that we've noticed even in our own communities is, individuals who are fully vaccinated are able to participate in uninterrupted in-person learning as long as they are free of symptoms. There's also a reduced economic loss for families. So for individuals, for children who have to quarantine, oftentimes families have to take time off of work or find childcare, which can be really costly. And so by having your children fully vaccinated, they're able to remain in-person learning, in-person learning uninterrupted as long as they're symptom-free. And overall, for schools, families, and communities, we're able to move closer to returning to the normalcy we knew prior to COVID-19 if we increase our vaccination rates. And this one really important reminder. So at this time, the Pfizer-BioNTech COVID-19 vaccine is the best tool we have to prevent SARS-CoV-2 related severe complications, hospitalizations, and death for individuals aged 5 to 11 years. But it's also important to know that the COVID-19 vaccines are not a panacea. The following mitigation measures are still important. So you still need individuals to wear a face covering while in public spaces, and when you're around individuals who not live in your household. Wash your hands regularly with soap and water, and use hand sanitizer when soap and water are not available, as well as practice social distancing. So making sure you maintain a safe space, the safe distance between yourself and others who do not live in your household when you're visiting public spaces. Thank you all for your time tonight. At this time, I'll turn it back over to Dr. Tishaura O. Davis.
Unmute. Thank you so much for that, Dr. Eccles. I know that's a lot of information to digest, but it's critically important information. And the main take-home points there are, this is the best tool we have in our toolbox. This is a safe and effective vaccine. It has gone through rigorous internal and external validation processes. These are checks and balances to make sure it's safe for our children, but that's not the only tool in our toolbox. We still need to be wearing masks, washing our hands, socially distancing. But I think now will be a great time for us to just open it up. Before we do that though, I'm gonna take 1 minute of your time. And we know that these vaccines have been available for a few weeks now. We'd just like to know how many of you have been able to get it for your child. So please take a minute to answer the question on your screen. It's popped up now, and just select your choice. We'll close this in about less than a minute or so. So if you could just Answer the question, has your child between the ages of 5 to 11-year-old received the COVID-19 vaccine? And you only pick one choice. The answer is yes, no, or I do not have a child in that age group. Thank you so much, everyone. So now to the part that I've been looking forward to, just being able to just have a candid conversation and talk about what it is that you need to get answered here. So it's time for our question and answer session. So as I previously mentioned, if you're joining us by Zoom, please feel free to submit your questions in the Q&A option. But we also gave people the opportunity to submit questions when they registered. So we'll be going back and forth between those. I know people get upset when their question isn't answered. So just know that we will be giving you the option for a follow-up town hall at the end of this, as well as providing an FAQ document on our website that answers the questions that you submit in the Q&A and that you submitted before that we didn't get to. So we're going to begin with a question that was submitted during the registration process. Kim, would you read that first question for us, please?
Yes, Dr. Monty. Again, thank you everyone for submitting your questions to us. Our first question this evening: if children aren't getting very sick from COVID-19, why should we vaccinate?
So I'll get us started with that answer, because I think this is such an important question and one I get the most from parents who interact with me in different medium. So this question gets to the heart of why I think this is such an important issue. Vaccinating our kids and people within this younger population prevents the likelihood that they can become very sick from COVID-19. Some children who are unvaccinated, we've seen nationwide, have been more susceptible to severe illness than vaccinated children, and that's across the board. But it also helps us in protecting family members. So this is not just a one-directional thing. You know, as we gather for the upcoming holidays, and we have Thanksgiving just a few days away, as more of our population receives the vaccine, we can also help protect our loved ones with weaker immune systems. The older, folks who have comorbid conditions that put them at higher risk. That's heart disease, lung disease, kidney disease, and a host of other things that the CDC can outline for us. And that's one of the trusted resources that I want you to access when you have questions about this. But the one thing I always say, and you heard, if you don't know much about me, my background is I'm an infectious diseases specialist. I'm a physician who practiced in infectious diseases. Just a month before I even took this job, I've been taking care of the sick in our hospitals, within our ICUs, and I've had to be the one to break it to families when they get sick. My husband is a pediatrician. He takes care of tiny little babies in the NICU. And so he has access to that patient population at Children's Hospital. And what I'll tell you is this: one death is too much when it comes to our children. Any children that we have no idea about the long-term symptoms, why would we even take that chance? So I get it that people love to deal with data and absolute numbers when it comes to children. Yes, children overall get less sick, but we absolutely have too many. My husband comes home and has that toll of having a NICU that's filled with kids on ventilators. Having to tell one family that they've lost any child to COVID is too much. And more so, these are children that are in the developmental process of our lives. We will never take the chance of what those long-term complications from COVID, which we know are way more of a risk than any vaccine that the kids can take would be. So it's really a risk-benefit analysis as to what are the risks and benefits of taking a vaccine versus the risks and benefits of getting COVID, which includes serious illness, being on a ventilator, or death. I'm always going to choose the risks and benefits of a vaccine that's been proven to be safe and effective. Dr. Eccles, anything else you'd like to say on this topic?
I think you nailed it, but I think one thing that we need parents to realize is that although overall the pediatric population may not have that severe complications related to SARS-CoV-2 infection, the CDC has reported that over 8,300 children in the United States have been hospitalized due to SARS-CoV-2 infection. And so you don't know how the virus is going to impact your child. And so why take the risk and not protecting them when you have a safe and effective tool that has been made available by the federal government and here locally.
Absolutely. So now I'm going to ask Suzanne, who's graciously volunteered her time as well, if she could give us the next question from the Q&A option.
Absolutely. We have a question. Do our 14-day quarantines prove to serve our children better in comparison to other counties that have shorter or no quarantine?
I told Dr. Eccles that I bet my money that the first question I was going to get wasn't going to be about the vaccine, but it was going to be about the quarantine. And I don't even say that to be flippant. You know, when I came onto this role, I had to hit the ground running with the pediatric vaccine rollout. But as I've listened to the school leadership, to parents, and I'm a parent myself, I understand how difficult it has been for families to be at a school and for half of the population to follow one mandate and another one to follow the other. So I'll let you know that I should have a definitive update around this, so that I want to prioritize, Dr. Eccles and I want to prioritize being in alignment with the county wherever we can. But what we do is lead with what is safest for our community and our city. And the reason behind not being able to get to that as quickly as we'd like to be, or at least before I came on, why Dr. Eccles wanted to make sure that this was done in an equitable fashion, is because rolling out any policy requires you making sure that nobody is left behind. And too often our marginalized populations, our poorer populations are not able to follow what some of those modified policies will mean. And what I mean specifically is going down to that 10-day modified policy requires that people have equitable access to tests. And unfortunately, because of budget constraints, the city does not have the capability to buy testing for our schools, for our families. That's something I'm working on right now and fighting for. But until we get there, I need to make sure that once we go to that 10-day, which again, I'm hoping to get accomplished within the next few weeks, that our schools are empowered to be able to provide any family that needs to do the testing requirement of that in a way that's equitable and safe. I come from a family of privilege and I'm blessed. So if my school did that within the city, I'd be able to go to Walgreens and buy a test as easily as this. That's not what every other family is able to do. So what I'm focused on is making sure we can get that done and get that done quickly. And I promise you that you'll be hearing more about that. I've been in conversations with the county, I've been in conversations with the mayor's office, and in conversations with the school leadership as recently as this week, but starting as soon as I hit the job, I knew this was going to be a priority. So you will be hearing about that and how we can do that in an equitable fashion. My hope is within the next couple of weeks. Dr. Eccles, anything to add to that?
I think you nailed it. So not only looking at the situation through a health and racial equity lens, but also understanding the social vulnerability index in the city of St. Louis. So we have a very unique population that has its own set of unique challenges that we have to be mindful of when we're establishing protocols and practices. The one thing we don't want to do as a health department is put our community at risk unnecessarily. So we want to make sure that we're crossing our T's and dotting our I's prior to making any changes.
Thank you so much. Kim, back to you.
Thank you, Dr. Mahdi. Our next question submitted through the pre-registrations. What advice can you give to parents who feel the emergency use authorization, or EUA, makes this an experimental treatment that is too risky for their child?
Can you say that one more time?
Certainly. What advice can you give to parents who feel the emergency use authorization, or EUA, makes this an experimental treatment that is too risky for their child?
Another great question. So first, let's talk about just the EUA, right? So an emergency use authorization, or EUA, is used to help emergency situations, like a global pandemic, to provide products that prevent serious illness and can be life-saving. So by virtue of that definition, we don't have all the time in the world to make those decisions, right? From the day that we're in a global pandemic, the public is looking to us for answers. And by definition, some of those answers are going to be answered in an emergency use fashion in the beginning. And then over time, as we've collected data, we can make adjustments as necessary. So an EUA responds to the fact that this is serious and needs life-saving responses. An EUA does not mean that the vaccine has not been tested. The COVID-19 vaccine for children in this age group went through the same clinical trials as the adults did, but with even more rigor. We waited on purpose to make sure that it was safe and effective in the adult populations. And then we were able to make dose adjustments because these are tiny humans. So the same dose for adults is not going to be the same for humans. And you want to do that in an incremental fashion that does not put any of those children at risk. And that was done successfully too, right? And so it went through the same rigorous process. And those vaccine trials are being conducted according to those standards that have been set forth by the FDA. So when parents are asking me this, that this is experimental, it's too risky. Once something like this has been issued, it has gone through all the necessary processes for this not to be considered in any way experimental. Now, we can give you that data, but it's your choice to make the best decision for yourself and your family. And that's something that I know is a hot topic for everyone. Dr. Eccles, anything else about the EUA process that you'd like to add?
And that's one of the reasons why I included the information about the clinical trial data in the presentation, because oftentimes that information can be overlooked or families may not know where to find that information. So it is a rigorous process for the FDA to even consider pharmaceutical intervention for the general population. And so there was a lot of work. There were no shortcuts were taken to get the vaccine approved for adults and for children. So it's really important for individuals to know where they can find that information. So a lot of the data from the clinical trials is available to the general public through the FDA. Some of that information is also available on the City of St. Louis Department of Health's website. I think it's also important for families to know that the research regarding for coronaviruses didn't start with the pandemic. So going back to early 2000s with the SARS pandemic, and then the MERS pandemic, that we've had over a decade of research on coronaviruses and vaccine development for coronaviruses. So they didn't have to start from scratch. But during this time, which is an unprecedented time, the pandemic, the federal government has invested over $9 billion in research infrastructure so that we could move fast forward some of the things that would typically take several years, even decades to accomplish. So having the financial support, having the previous research that had been conducted, and having that data available to the pharmaceutical industry as well as our national partners at the NIH and the CDC, we're able to make strides over a shorter period of time. And so no shortcuts were taken, but there was a huge investment by the federal government to make sure that the vaccine products and other pharmaceutical interventions that are coming out of the COVID-19 pandemic are indeed safe and effective before they are made available to the general population.
Our next question submitted through our pre-registration. How does the vaccine affect children who are asthmatic?
So, and this is a question I get, I actually get more than you would realize. And so when you think about the vaccine itself, there's two populations I want to address: people who are getting vaccinated, and then the risk that you get from just having, the risk that you have of getting COVID if you are unvaccinated. So when you ask me about the risk of what risk it poses in asthmatic, the vaccine itself, the clinical trials to date have shown that there's no individual risk that a child with asthma has from getting the COVID vaccine. In contrast, asthma, along with heart disease, kidney disease, and a list that you can find on the CDC's website, will actually put your child at increased risk of severe outcomes, severe hospitalization, or death if they were to contract COVID. So one of the driving factors for anyone who has a child who is asthmatic would be to try to use the best tool in our toolbox, which is the vaccine. But as far as the vaccine itself having an effect on asthmatics, there is nothing that came out from the vaccine trials that links any sort of causal negative side effect to the vaccine for asthmatic children. Dr. Eccles?
One important thing that we try to emphasize for all parents, so if you have children who have underlying medical conditions, please consult your medical provider to get accurate information about how it will impact them. And we can tell you from public health or a general standpoint, but your child may have other issues that may impact how a vaccine may impact their system. And so make sure you follow with your child's medical provider and ask any questions you have related to the vaccine to make sure that you indeed feel safe getting the vaccine for your child before you do so.
Thank you so much. Suzanne, I'll come over to you to see if there's anything from the Q&A.
Oh, yes, lots from the Q&A. The first one I'll throw at you is the vaccine for children 5 to 11 years old safe for children who are old enough but are physically smaller than a 5-year-old? And when can we expect our 4-year-old to be able to get vaccinated?
Ooh, one more time again, because that's a really good question. So one more time, Suzanne?
Yes. So is the vaccine, the current pediatric vaccine for children from 5 to 11 years old, safe for children who are old enough to get vaccinated but are smaller than an average 5-year-old? Also, when can we expect our 4-year-old to be able to get vaccinated?
I love town halls. People always come with such great questions. So absolutely, the dose adjustments that we're talking about in the long-term clinical trials take into account that exact question, right? What do we need to do to make those doses safe and effective for little people, regardless of whether your child's a little bit smaller than another child? That is all taken into account, and this makes it very safe. I have a baby who's not quite 4. She's still a year and a half. So I know that she has some time away. So what we know is that right now, Pfizer and Moderna are enrolling for their clinical trial data that they hope to submit for EUA and FDA approval within the early part of next year. I'm very careful because I've been burned as an infectious disease specialist throughout this pandemic, where people want you to give a date. And then the moment you don't bring that date, they're real mad at you. So what I'll say is, Pfizer and Moderna are only going to submit that data when they have good data, when they feel that they've reached a safe and effective conclusion in those trials. The estimate is early next year, so I'm hoping that for 6 months and above, we will have something by the beginning of next year. But again, that all will be dictated by how those clinical trials are working out. Dr. Eccles?
I think you covered. I don't have anything to add.
Okay, great. I always know I've done a good job if Dr. Eccles says nothing more to add. I like that. Back to you, Kim.
My apologies. Thank you, Dr. Mahdi. What are some of the side effects, both short-term and long-term, that my child may have after receiving a COVID-19 pediatric vaccine for children 5 to 11 years old?
Great question. And I think this is a great important take home from Dr. Eccles' presentation. So Dr. Eccles, I'll have you maybe summarize that because I know you addressed that within your portion at the beginning where you presented the data, but especially for folks for whom this is a lot of information coming at them and they could use a refresher, but also some of our attendees that came late. Could you review those answers, please?
Absolutely. So for the most common side effects, which are typically pain at the injection site, as well as fever, fatigue, those typically start within 24 to 48 hours after the individual receives a dose of the COVID-19 vaccine, and typically resolves within the same amount of time. So it typically resolves in 24 to 48 hours as well. As far as other long-term impacts of the vaccine, so that's something that we're still studying as well. And so that's why the reporting of any adverse reactions is mandated for all COVID-19 vaccine providers and Pfizer Incorporated to make sure that the federal government is aware of any issues related to the vaccine product that has been made available to the general public. So as the information becomes available as relates to side effects and other issues with the vaccines, that information is made available to the general population as well, and so we can make informed decisions about how we move forward.
Thank you so much, Dr. Eccles. Suzanne, I think we're back to you, right?
I've got questions waiting for you, so that'll work. How long has the study that Dr. Eccles referenced been ongoing? 3,100 people children received the vaccine, but do we have any long-term data?
Dr. Eccles?
So long-term data is not yet available. So a lot of the clinical trials and so forth were started during the pandemic. And so typically you have more time, but when you're in the middle of a pandemic, you're able to not only conduct the clinical trials because you have a special population, you have a larger population than you would in non-pandemic times to have participants as well as individuals who have been impacted by a particular illness or disease. And so we don't have what we're typically will consider long-term data, but the clinical trials are ongoing, and as information is uncovered or discovered in these clinical trials, it's made available to the general population.
Thank you for that, Dr. Eccles. So we will take it back to you, Kim.
Thank you, Dr. Mani. For those parents who have decided to receive or have their child vaccinated for COVID-19, how can parents and caregivers access the COVID-19 vaccine for their child?
One more time, Kim?
For those parents who have decided to get the vaccine for their child, how can parents and caregivers access the COVID-19 vaccine for children 5 to 11 years old?
So we are working with several partners to hold pediatric COVID-19 vaccine clinics around the city of St. Louis. Those partners include Affinia Healthcare, Care STL, BJC's Healthy Kids Express. But really what we've done is focus on the lead being our 4 FQHCs and community leaders and partners, because they've earned the trust of the community. But we've also wanted to make sure that we have partners where kids feel most comfortable. That's their schools, their doctor's offices, or healthcare providers. So we've also partnered with school leaderships for events that are school-based, as well as our 2 main health systems to make sure that we have those partnerships as well available to you. If you go to the city's website, I'm going to ask Kim to put that link in the chat or in the Q&A option so everybody can see that. We update on a week-to-week basis where those clinics are at any one time, but also places that have their own clinics that you can make an appointment for, so that you have the gamut of choices for what is most comfortable for you and your child. So that is how we're making this accessible in the city. Dr. Eccles?
Nothing to add, you killed it.
Come on, man, I'm doing so good tonight. I think this would be a good time. If you look in the chat, you can see the link to our website where those clinics are available for the public. So Kim, I'll bring it back to you.
Thank you, Dr. Mani. Are schools eventually going to require the vaccine for in-person learning, similar to other vaccines?
So that's a great question. And the very simple answer is that the list of vaccinations required for schools and for children who are of school age is set at the state level. So that's not set here locally. Dr. Eccles, anything else you want to say about that?
Correct. That's that decision is made at the national level, and then each state would need to adopt that as part of their legislative process. And so that would take a long time to happen, potentially.
All right, back to you, Suzanne.
Okay. Can you share some specific advice for standing strong against growing numbers in the school community who are anti-vax or anti-mask?
Oh, that's a heartbreaking question, and that's hard because I just, I'm a parent. And so I really understand that I would never, ever, ever, ever subject my child to anything that I wasn't comfortable with or felt that was the safest and best decision for my child. And I am fortunate to be an expert, right? I'm an infectious diseases doctor. I have a public health degree. So when this data comes out, I'm able to evaluate it in a way where I'm able to say, is this good data or is it not? And the thing that I am really disappointed about that's happened throughout this pandemic is that we've lost the ability to know who our trusted messengers are. And somewhere in all of this, we started going to folks who may be well-intentioned, but may not have the expertise, right? I respect my elected officials, but they're not physicians. They're not public health experts. So I would start with those folks and trust that I have no stake in this other than the training that I've been given and want to be able to give to the public. So it is such a difficult position we find ourselves in. And I understand that. And so for people who don't want to get their children answered, it's my job to try to find out what is still an issue there, what is still the question, how can I help get them those trusted messengers from trusted and trusted resources. But at the end of that, I have to respect that everyone has the right to make the best decisions for them and their families. The only thing that is different here is that that decision is different when you are a person who is forward facing for people who are at high risk. Then there are exceptions where it's mandated, right? But for parents and children, the best thing you can do is understand who is a trusted messenger, where are your trusted resources? For me, trusted messengers must always be people who have that medical, scientific, and public health expertise. And those trusted resources must be those very same areas. Those places are not Facebook. They're not WhatsApp. They're not, the group chat of folks who may not have even finished biology. That's a great place to maybe have a discussion, but not to make final decisions. But at the end of the day, it's my job to give you information that I hope is accessible so that you can make the best decision for you and your family. Dr. Eccles, anything you'd like to add about that question?
I think you're absolutely right. So the role of the health department isn't to coerce individuals, but really to be an agency that provides accurate information for public health issues so that we empower our community to make informed decisions so they can do their very best to achieve optimal health, which means going to preventative health sessions, as well as deciding whether or not to get a COVID-19 vaccine. So there's a lot of challenging issues that we have on the health front, not only in the city of St. Louis, but in the St. Louis region. So the one thing that we have to make sure that we're always doing is providing accurate information to the community at large so they can make the best decision possible for themselves and their family. But ultimately, the health department is responsible for protecting the health of the entire population, not just certain pockets or certain segments of the population. We have to adopt practices and protocols that are scientific and evidence-based to make sure that we aren't causing additional harm or unintentionally causing harm to the population that we serve.
Thank you for that, Dr. Eccles. Couldn't have said it better. I'm gonna kind of deviate from the plan and make my team anxious because there's some questions in the Q&A. I wanna make sure people don't think we're avoiding. It's hard to get all those questions. So I want you to know that there's absolutely no way I can answer all of these questions meaningfully tonight. So we're going to give you an option for a follow-up. I'll ask my team to prioritize questions we didn't get to today, but also remember we'll be doing some questions in the FAQ. So Jeff is asking some really good questions about why we aren't taking the liberties that the CDC has afforded us to decide how long the quarantine should be, and that some of that gives discretion as to how people don't need testing. It is my job to look at the case positivity rates, the overall cases, severities, and death, and also the risk-benefit analysis for the city. The United States is very large. What's happening here is not what's happening in other states or cities. And so I have to look at what is the risk of me not providing testing for children in the city according to the data that I have available, and what will that do to if we do have increases in cases as a result, or for the type of the way that the hospital systems that we have set up, in understanding what I have access to that the general public doesn't, about how quickly we get overwhelmed, our bed availability, and things of that nature. Based on all of those criteria, we have decided that while we are willing to take a modified quarantine approach, that we will require testing. And some people do daily testing, some people do 3 times a day. We're trying to be as reasonable as possible and say twice testing for people that are unvaccinated. So people who are vaccinated, we know that the data says that they are safe to continue in school, but people, and with some criteria put in there for the safety of those, so these are people that have been exposed but are vaccinated. They can continue in-person learning, but there are some safety measures that have to be implemented to make sure that they're not creating any additional risk to folks at school. But for folks that are unvaccinated, because the data is clear that the risk that they pose to the general public is much greater than those that are vaccinated, they need to be quarantined for 10 days. And in order for them to safely resume, based on, again, my evaluation of multiple metrics of where we are in the city, we will be requiring at least people testing at least twice during that period. That is why we are making that determination. Not everyone's going to agree with me, and that's okay. Happy to take feedback as long as that feedback supports not only what the national trusted messenger and trusted resources have put in play, but also the considerations of what's going on in the city. I am not making that decision unilaterally. Again, I am speaking to public health experts, medical experts at the city level. We're talking to experts at both at our main academic school centers. We're in conversations with our school leadership, and we are in conversations, and we are using data, again, data that is coming from our epidemiologists who have been doing a superb job of tracking this throughout the pandemic. Dr. Eccles, anything you want to add about why we will take certain approaches to this if we can get there?
As I said before, so we're responsible for the entire population. So sometimes the decisions that we have to make, we're adamant about them being based on the best available science, oftentimes may upset certain pockets of our population, but we have to make sure that we're able to justify why we're taking certain stances. And that's been the intent and the goal of the City of St. Louis Department of Health since the beginning of the pandemic. We didn't want to just make decisions unilaterally. We wanted to make sure that we were able to bring the public along with us so that the general population could understand why certain decisions were being made that were necessary to mitigate the spread of SARS-CoV-2 in our communities.
And Jeff asked a question about, have you looked at how our data compares to other counties who've had shorter quarantines and how they're doing? That's the exact approach for the proposal that I put together to be able to get there. Like I said, I think we're going to get there. But you need to understand, I had an easier job before I was in city government, where if I thought we needed to implement something in our hospital, it's much faster for me to say, look, I have good data to do this, let's do this. We have to go through policy writing, legislative approvals. It has to go through many, many boards to get here. I've only been here a month, folks. Give me time. I'm very confident that we're going to get there in a reasonable amount of time, but it's not just about the fact that I now agree that we can do this. It's about it going through all the checks and balances that have been put through at the city government level to protect us ultimately, but that can be frustrating for the public sometimes because it can slow down the process. So, since I've been here, this is what the focus has been. And again, I think we're very close to making those adjustments. Again, going rogue, I wanted to see, there was a question about infertility that I saw that I wanted to address because it's interesting when people slide into my DMs and ask me questions about the COVID-19 vaccine. Infertility is one of the biggest things that they're concerned about. So I wanted to address that and say that there has been no data that has shown a causal link between the vaccine and infertility. One of the biggest things I say is we haven't had enough time to look at long-term data. And sure, it can take years and years and years and years, but what people for any one of you to feel 100% sure. But what I think everyone fails to realize sometimes is unless you have never used any vaccine that is currently in circulation, which puts you in a different pocket of people, and that is your God-given right, if that's what you choose to do. But every single vaccine that's out there has gone through the same sort of clinical trials, and we haven't had years and years and years to follow long-term data. What we do is we have rigorous processes that let us know that the risks and benefits of the vaccine way, way outweigh what could happen if you actually got the disease. And I think sometimes that's where the disconnect is people think that they're making a decision about just the vaccine in isolation. If you are able to make a decision that weighs the risks and benefits of the vaccine versus what would actually happen if you got COVID. So for example, we're talking about infertility. What would happen if you as a young woman were to get COVID? What happens to you as a young pregnant woman if you get COVID? Those risks far outweigh any risk that we have ever seen with the vaccine studies to date. So again, never an absolute 100% either way, but the risks and benefits of the vaccine far outweigh those of not getting the vaccine and if you were to get COVID. I'll stop going rogue now because I'm sure my team is very, 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 very mad at me. And I'll go back to Kim and then right back to you, Suzanne.
Thank you, Dr. Mahdi. Another question that was submitted during the pre-registration, and thank you everyone for joining us and continuing to ask these questions in the Q&A box. What has been the biggest challenges to parents and caregivers to getting their children 5 to 11 years old vaccinated?
One more time, Kim.
What has been the biggest challenges to parents or caregivers to getting their children between the ages of 5 and 11 years old vaccinated?
Thank you for that question. There's a couple of challenges. We first need to make sure parents and caregivers have accurate information about it. That's the purpose of this town hall. And I think sometimes it's hard for people to both access that information, but to digest it. I don't think a lot of times those of us in these positions do a great job of speaking to people where they're at and in a way where they can understand that information. So that's something that we're really working hard at the city, at the Department of Health. And what we want to hear more from you about, like, what can we do to better meet you where you're at and get you the kind of information we need? But after that, we need to help them understand how to find the vaccine once you're ready to have your child vaccinated. So what we're doing there, like I said earlier, is updating our website regularly with new vaccine clinics. And parents can also visit vaccines.gov to find commercial clinics that provide the pediatric vaccine. So my goal is not just to say, do what is on my website. My goal is to give you a plethora, a wide, diverse a menu, for lack of a better word, for you to be able to decide what's best for you and your child. Is it something in a healthcare system or with your doctor? Is it something in Walgreens or CVS? Is it something in one of our community-based partners who really, I cannot say enough how great of a job our 4 FQHCs and their leadership have done in leading the charge. So is that the best place for you? Or would you like to come to our vaccine clinics? You know, I was at one at Vashon High that SLPS did this weekend. We had water available, snacks. People got to wait in an auditorium based on feedback from our first event where it was difficult to get people in fast enough and it was cold. So we said, you know, that's our bad, let's do better. And so this time people are in a warm auditorium, spaced out, masked. We had a movie playing while you waited. People, the wait times were much less because we were able to get more people vaccinated because we had a higher staff available. We have gifted card incentives. And so maybe that's a better avenue for you too. But that website, the city's website, will be able to give you a menu so you can decide what's best for you. Dr. Eccles?
I think the misinformation and disinformation circulating in the community definitely played a role in individuals lacking confidence in the COVID-19 vaccine. And so that reduced the likelihood that individuals actually access the vaccine, even if given the opportunity. The other issue is the history of health service delivery in the city of St. Louis and the St. Louis region, particularly for indigent population. And so there's been a history of maltreatment, abuse, and exploitation amongst minority populations in the city of St. Louis. And so being mindful of that, you know, that they've experienced trauma for several decades. And then even though, you know, we have this life-saving tool that's available, you know, the individuals that's maybe providing the tool may not have the best reputation in those communities. And so really working more diligently, more closely with community, using a trauma-informed, as well as culturally and logistically appropriate approach to communities has really been critical for us to really create a foundation where we're able to reestablish or establish trust, so we have a better path forward, because the issues that we were facing related to the COVID-19 vaccines are not new. When we look at the immunization rates for City of St. Louis school-age youth as well as adults, it's much lower than what we would like for it to be. And a lot of that is due to the harms that have been caused. And so acknowledging the harms that have been caused to our community, the role that our particular institutions have played, as well as working with them to create a better path forward, have really been critical over these last 18 to 24 months.
Awesome. Thank you so much for that, Dr. Eccles. I think understanding that we all don't have the same level of trust and that it comes from a valid place. A lot of our communities have had really bad experiences with government, scientific, and hospital systems. And it's our job to build back trust, but you don't build back trust overnight. And so it's important to put the people that they trust, who have done right by them first, so we can get that done. Back to you, Suzanne.
All right. Does the vaccine have any interactions with other medications that children might take? For example, allergy medicines such as Claritin or Flonase?
Whew, so many good questions tonight. So the only contraindication that the CDC has outlined as the contraindication to not getting the vaccine is if you have a known allergic response to component of the vaccine. So and this isn't, I took a vaccine some time ago and then I passed out, and now I know that that's a definite allergy. It has to be a medical provider, a medical specialist said to you, you have a severe allergy to a vaccine and you should not be taking vaccines without talking to your medical provider or at all. And those components, the CDC does a great job of actually having a whole page dedicated to this, and they list all the components, and so that you know if you have an allergy or not. Other than that, if you're on medications, the recommendation is to speak with your primary care physician, and if you don't have one, you can reach out to the health department for us to try and link you with healthcare services for someone to be able to advise you, so that you are not making a decision about whether to take it, because again, there's no known medicine that makes it so you can't get the vaccine or your child can't, but there is good timing, right? So for example, if you're about to take a large dose of steroids or you're on chemotherapy, the best time to take that would not be a few hours afterwards or the day after. You want to give your body the best chance to be able to mount an immune response to be at its best. And so it's usually just a matter of timing, and you should be talking to your medical professional, not a matter of you can't take it. Dr. Eccles, anything I left out?
No, you covered it well.
Thanks. Kim or Suzanne, what do we have next?
Okay. Do you anticipate children needing a booster? And if so, after how long?
Oh, I love this question. Also breaking news, right? The CDC finally said that anyone above the age of 18 can be eligible for a booster. I think that's incredible news. And so the city is going to be making that available to everyone above 18 years old. Line up, get your boosters, look on our website, and again, sign up as soon as you're ready. But for kids, I really do think that what we're learning about the science of COVID, the fact that you do get these antibodies, but it's evident that they don't last indefinitely, and that what made that more difficult to have that long-term antibody response was the fact that there are these variants that have popped up, most specifically how Delta kind of ruined everything for all of us this summer, and how it's possible that other variants may pop up. And the only way for us to beat the variants is to get to herd immunity as quickly as we can. But until then, it's about then the fact that there is this wane, this decrease in concentration of antibodies after a period of time, and that the CDC has made the recommendations about when we should get boosters based on that. So the boosters are just to give us that best robust response so that we are not in society feeling like, well, I got a vaccine, I'm probably fine, when really over time, you may not be at the highest level of protection that you were when you first got the vaccine. I fully anticipate, we don't know for sure. Again, the studies that children were enrolled with are not just over, they're ongoing. So we'll be able to evaluate that as people are getting their vaccines as to whether there's going to be a difference in whether children will or will not need a vaccine. So my answer is I, based on the evidence that we have from adults, anticipate that will happen with children, but I never say never, and I never make a final decision until I've seen the data that is specific to children. Dr. Eccles, anything to add about what you think about when we should anticipate boosters?
I think you nailed it as well. So, this is a very fluid situation. So we don't know what is in store. So we have to rely on the researchers to do their job, and then also make sure that they are providing the information to us in a way that is transparent so that we can make the proper decisions, and the FDA and the CDC can make proper decisions as it relates to the new recommendations for COVID-19 vaccines for the population moving forward. So it's a very fluid situation. We don't have all the answers at this point in time, but as the research continues, not only for children, but also for adults, more and more information will be coming out. And our duty as a health department is to make sure that information is made available to the citizens in this jurisdiction.
While we are entering the cold and flu season, what does the data suggest as a predictor of the upcoming winter months? Are we going to have a twindemic?
Whew, good one. That's a tough one. We can only go on, we have 1 year to compare to, right? And we know that winter was particularly difficult for us because winter poses a few issues. Number one, we are unable to have adequate ventilation the way we do outside in the warmer climate where ventilation is the best, right? And so we're indoors more, and we know that being indoors increases our risk for transmission. We also are in a winter season that with it brings flu, but also a slew of other respiratory viruses that people can get sick from. So the concern is not just, can I get COVID? It's, can I also get sick from other respiratory viruses? And more importantly, do our hospitals have the capacity to hospitalize people who are severely ill from COVID, flu, and all these other respiratory symptoms? What I'll tell you as an infectious disease expert is that we have never seen the low numbers of children and adults with flu that we did in the year that we had COVID. And the only major difference that we had made was masking. masking, and the other mitigation measures like social distancing, like sheltering in place. So we know that if we do those same things this flu season, we're less likely to have a twindemic because we did so well with that last year. But the best way, the best tool in our toolbox for flu and for COVID is the vaccine. So I highly encourage everybody to get their flu vaccine or their booster if you're now eligible, so 6 months from your first dose and above the age of 18. If you afford this before this winter season, so now, and to do the same for flu. A question I get often is it safe to take them both at the same time? And we looked into this after last season, and it's absolutely fine to do so. So don't delay one or the other because you think that you should not take them at the same time. There's no evidence to suggest that. Dr. Eccles, anything you'd like to add about flu and COVID and winter?
I think, that was a great reminder that the mitigation measures work beyond COVID-19. I think with the pandemic, we developed tunnel vision and the focus was just COVID, but then we saw the benefits of wearing face covering, social distancing, and practicing good hygiene with the very mild flu season that we had last year. And so if individuals are really dedicated to protecting themselves, protecting the family and the community, we will see more individuals wearing face coverings when out in public, and as well as implementing those other mitigation measures in addition to getting vaccinated for COVID-19 and influenza.
All right, folks. I think we can probably take one or two more questions. So Suzanne or Kim, any questions?
There have been a couple questions about the effects of certain brands of vaccines and their side effects. For example, myocarditis for Pfizer in adolescents and thrombocytopenia for the J&J vaccine in certain ages of women. What are your concerns as a parent about the Pfizer vaccine for our pediatric cases?
Yeah. Again, when I look at this data, I have to compare what the side effect data tells me about the vaccine versus what I know our kids can get if they get COVID, right? So the J&J example is a great one where those statistics weren't great for the J&J vaccine. I mean, people got really scared. But what most people don't understand is that when you look at the general risk that you can get thrombocytopenia and the long-term risks that you can get from COVID in general, the risks, the benefits of getting the vaccine still outweigh the risks. Now for J&J, we say that if you're in the category of people that is women in the adult to elderly age group that were most likely to get those blood clots, for example, first have a discussion about the risks and benefits of getting specifically J&J with your healthcare provider. The same thing is true of any of the other risks. So if you have a particular concern about myocarditis, the data from the clinical trials for these kids showed that the numbers were low, but there weren't enough data for us to say anything meaningful about the long-term effect. And if that is the case, then what we need to do is if you have a child that may have a pre-existing disorder that makes you concerned about the Pfizer vaccine specifically, then you should be having that discussion with your pediatric provider. However, you're right, there's nothing long-term that we can say about myocarditis, so you have to make the best decision for you based on what your child is going through, and I would have that discussion with a healthcare provider. Dr. Eccles?
I agree.
And any other questions?
I think we cleared the queue. Oh, wait. Let me take a look.
Yeah, we have one that just came in.
Yes.
The question is, sorry, go ahead.
Do you recommend vaccination after having COVID? And what do you think about natural immunity?
Natural immunity is beautiful. It keeps us safe against a host of other things. Unfortunately, natural immunity doesn't work for us being able to protect ourselves from COVID-19 in the long term. It just isn't going to be a one-stop answer. So natural immunity can only get us so far. And the reasons we had to develop these vaccines is because natural immunity wasn't cutting it. We saw these record high numbers of people getting COVID throughout this pandemic. And there was nothing really that we could do about that without having something else to help protect us. And the second part of that question, Suzanne or Kim?
Do you recommend vaccination after having COVID?
Yeah, that's a great question. Right now, the CDC says that you are eligible to get a COVID-19 vaccine when you are asymptomatic and you finish the quarantine period. So you can get it as early as that, or you can wait up to 90 days. So anytime within that range. I would say that absolutely I would recommend it, because even since that recommendation first came into play, we now know that you do have that waning of antibodies after a certain time. And we have all of these other variants in play that really change the game of how quickly you can have transmission, specifically that Delta variant. Dr. Eccles, anything to add?
I think the point that you raised about the different strains circulating in the community is really important. So although you may be infected with one strain, you may develop natural immunity to that strain, but you're still susceptible to the other strains that are circulating, not only in the United States, but in other parts of the world, especially with international travel. It only takes a plane ride for a new strain to be introduced into our community. And so you remain susceptible to those other strains. And then, as Dr. Mata mentioned, so your natural immunity wanes over a period of 90 days. So after 90 days pass, you're essentially back at square one. You're susceptible not only to the other strains that are circulating, but you're also susceptible to the strain that you were previously infected with. And so vaccines remain the best tool that we have to prevent severe complications, not only for one strain, but the strains that are circulating in the United States.
So to me, that's so important that Dr. Eccles added that, because I think sometimes people lose exactly how much goes into the risk here. It's not just unidimensional. There's a couple of, I'm going to go rogue again. There's a couple of questions that are in the answered portion and that we have been answering by typing to you. If they've been simple, I want to shout out our incredible team, Suzanne and Kim, who've not only been verbally asking questions, but have been helping us keep up with the many questions that have been asked and have given some verbal quick answers. I also can tell from some of the people joining that you don't agree with me or Dr. Eccles, and that's your right. I can only give you the expertise that comes from my background as an infectious diseases physician, public health expert, but at the end of the day, it's your choice as to whether or not that's information that you're going to take, or if there's other trusted messengers and trusted resources you'll use. Hopefully, those will include the CDC, the FDA, and all of the researchers and experts that have spent literally their lives and their training to get us this information. But at the end of the day, I have made myself available. Dr. Eccles will continue to do so as often as you need. One question that was answered by our experts by answering in chat form was, can children be asymptomatic? And the simple answer is yes, they absolutely can. And that's why we recommend vaccinating children, not just to protect them, but because if they're asymptomatic and are doing great, that's wonderful for our kids, but we can't put our family and the rest of the community at risk too. I think we have time for one more question before we close. So I'm going to ask Suzanne or Kim if there's anything that you've seen.
Kim, do you want to do your?
Dr. Mata, just to piggyback on what you said about children being asymptomatic, it's also important for those who are fully vaccinated to understand that they can be infected and infectious, but asymptomatic. And so that's one of the reasons why those mitigation measures are really important to implement. So making sure that you still wear a face covering, because it's not only about protecting yourself, but protecting those who may be around you. You don't know the vaccination status, you don't know the medical status of those people who may be around you, particularly when you're in public spaces. And so doing your very best to show compassion by wearing a face covering, social distancing when you're out in public is really important, and it goes a long way in helping us slow the spread of SARS-CoV-2 in our community.
All right, last question, what we got?
Okay, this was
go ahead.
No, okay, this question was submitted earlier through our pre-registration. Do you foresee any behavioral side effects from taking the vaccine?
Whew, that's such a good question. You know, I've looked at the data from the clinical trials in adults and for kids. There has been no significant data to show, or even any sort of trends that I saw towards that. It's something that I'm sure many parents worry about, but these are thousands of kids that were looked at, and there was nothing to suggest that that will come into play. On the flip side, as far as COVID goes, I've been a part of, following patients who've had COVID. Following patients who've had COVID for months and now close to 2 years after the fact. And they have long-term effects, both physical and mental. I have patients who were otherwise healthy before, but who have had persistent symptoms that have affected their lives long-term, that have affected how their behavioral health long-term. And so for me, the risk versus benefit is clear that the vaccine is one of the best tools. I will give some tough love and say I saw one person say that they asked 5 questions and we only asked 1. We've had almost over 30 questions or 35 just in the Q&A. And Kim, help me out here. How many did we get registered, sent to us beforehand?
Had about 43 that were sent to us, and some questions were duplicates.
Yeah, so that's over 80 questions that were submitted for an hour-and-a-half vaccine. I've already given up on putting my kids to bed tonight, but I'm happy to stay and answer all 80 of those questions tonight. It's my job, but I do think that we have to be fair and make sure that people who ask just 1 question get their question answered, as opposed to one person who may have asked 5. So like I said in the beginning, we'll answer as many of those as we can in the FAQ. We're also going to make this forum available afterwards. So hopefully that answers that 1 question that also popped up in the chat. I'm going to squeeze in 1 more question if there were any. Anything from you, Suzanne or Kim, that you think I could end with, or how are we, because we have 5 minutes before we have to close.
Can I share a nice comment?
Oh, Suzanne, I would love a nice comment.
We've had a couple people say that this was a great presentation, and I happen to agree, but we seem to forget that we still vaccinate against many childhood diseases, even if our children have had the disease, because we want to keep them safe. This is like the same thing. Thanks for the presentation. It was great.
Oh, thank you to whoever you are. Listen, I can take it. I can take people not agreeing, people being upset with me, because that's the job. I'm always happy though if this forum that we've created is one that's helpful, and that's our ultimate goal. And to that extent, we're just going to ask you to answer a quick question now. So what I'm going to ask is, we're interested to know if you still have questions about the vaccine and would like another town hall. So please submit your response on the poll on the screen. I will say for you to look out for future events that we'll be having on our website and from the Department of Health. So the question reads, would you like to see an additional town hall on the COVID-19 pediatric vaccine? And your choices are yes, within the next 2 weeks, yes, before the end of the year, no, I feel like I have enough information at this time, or I don't know, I'm unsure right now. If you could take some time to answer that, and then Kim or Suzanne will let me know when we're done with the answers.
It looks like most people have submitted their responses, so I'll be closing the poll.
Okay, thank you so much. So I will say that I actually can't believe we've come to the end of our time tonight. We've been planning this for quite some time. I'll admit I was a little bit nervous. Dr. Eccles is a seasoned veteran, so he was cool as a cucumber. But I'll admit, as a first-time director, that I wanted to make sure that we did this right. And I think we did, but that's because of a few people that I want to thank. First of all, our Honorable Mayor Tishaura Jones for making the time for this. It says a lot about her with everything on her plate, and it shows how important this is to her, both professionally and personally. So thank you. I want to thank our DOH staff who have worked tirelessly to make this possible. Specifically, our PIOs, Kim and Harold, who have worked way more hours than they are expected to, who have been really passionate about this and have done a phenomenal job. To STL TV, who have supported us, and to Suzanne, who volunteered her time. It's not even her department, just said, I'm here if you need me, and did what needed to be done. So thank you so much, Suzanne. As always, I must thank Dr. Eccles, who really has led the city through the pandemic since it started, who I'm honored to join in this charge now moving forward. But most of all, thank you to all of you. This is extra time from your jobs, from taking care of your families. You're frustrated, you're tired, you're scared, you want to go get to our new normal now, but you still made time to do this. And most of you, overwhelmingly, most of you, in the most respectful and helpful and productive manner possible. So thank you to all of you. So the recording of this town hall will be available on the City of St. Louis's YouTube channel within the next 24 hours. Also, we'll be compiling the questions and answers from tonight into a Q&A document that will be posted on our website. But finally, if you have any questions in the future, please call us on our hotline or email us. That information is available on our website. So if you are, taking some time, please just look. We've got the hotline up right here on the screen. You can take a screenshot. Our email is up. You can visit our website. It's up there. And again, the place that you can send a recording of this town hall to your friends, to your family, to people that you work with is also up. So I'm going to leave that up just for a few seconds. I am proud to say that we stayed on time. It's 7:29. As soon as we hit 7:30, which has just happened, I only have left to say thank you again. Have a wonderful rest of your evening. May you have a safe and blessed Thanksgiving holiday. Remember, mitigation strategies work. Please utilize them to keep yourselves and your families safe through this Thanksgiving holiday. And I'll end by saying, be well, St. Louis. Thank you.